Hi, I'm Dr. Brian Kerner. I have a practice of chiropractic in San Francisco, and I've been practicing for 27 years. I want to go over a little bit more what can happen to you if you're in a bad position ergonomically at home or at the office. The concern is, as you're sitting or standing, your head is going to be forward a bit as you get curious in what you're doing. It's a habit that many people have. When that happens, it causes increased compression on your spine. And the little spinal joints of the body actually start to get more compressed and jammed. The nerves that come between the vertebrae can get irritated or inflamed. What happens is, as the head goes forward, more compression occurs over the spinal joints, particularly right in the middle of the spine at the C5-6 area. If I press the button, which correlates to where the nerves come out, you can see on that chart on there where the nerves are pinching on that side. So it actually refers down into the upper trapezius, down the shoulder, and all the way down to the hand on those nerve roots. So sometimes people can be complaining that they have numbness, tingling, or burning into their hands, and that often could be due to some of the compression that occurs in the neck, not just down in the extremities. These joints should be like a bridge supporting the delicate nerves that come out of the spine with shock-absorbing discs between the vertebrae. As you can see in a good neck curve, there's good where those dark spots are, is good where those cartilaginous discs are located. But as we lose the curve, the head goes forward, more compression occurs, and degenerative discs can develop, including spurs. That's the cause, or synonymous with actually osteoarthritis of the spine. The other area that is affected by compression as the head goes forward is what's called the cervicothoracic junction, this area between C7, T1, and T2 in the thoracic spine. So the various techniques that I use to help those areas become more flexible with decreased pain and decreased inflammation is specific motion on the spinal joints. So along with chiropractic adjustments, we incorporate various therapies to help speed the healing. Both cold laser, for example, as well as pulsed ultrasound help decrease pain, decrease inflammation, and improve tissue healing. So to give an example of how we can utilize better posture in not only the workspace in the office, but also bringing it back to the home, I want to show you some ways that we can do that. So I want to explain to you what not to do and what will actually bring you extra visits to the chiropractor that you shouldn't have to have. So a lot of people are using their dens or kitchens and different tables right now. So they would be sitting here and having their laptop on their kitchen table. And what this is doing is not supporting the spine and the back by having the back not against the back of the chair. The feet are sometimes dangling, which is hard on the back as well. The wrists are actually an extension, and that's actually putting extra pressure on the wrist. The elbows are on the table, which is a little stressful as well, and the head is forward, which is actually putting extra pressure on the neck and upper back. So with this setup, it's more comfortable and supportive for your neck and back. The chair is very important to have good lumbar support. If you're not sitting back against the chair as well, you can get a support pillow, maybe a more supportive cushion from Amazon, or just use a regular pillow. In this case, we have an external keyboard and mouse, and it creates more angle of a 90-degree angle for your elbow, and also makes it easier on the wrists. Eyes at the top of the monitor using a laptop stand. I've got my feet flat on the floor, not dangling. You could use a footrest if needed, or a couple, like a box. So it's important to stand as well throughout the day. So rather than having, if you don't have a sit-stand desk, you can use the counters in the kitchen, which are higher up. I created a ergonomic space by using books. As well, I threw in the laptop stand as well, or you could use just books. And I've got the external keyboard and external mouse, and then I've created a very good eye to computer distance, and it's a lot more comfortable. Focusing on workspace ergonomics is extremely important, and I recommend this to all my patients as well. If you're watching this and you're not a patient, I recommend it for you as well. Being in this position will allow you to be more productive in your workspace, along with taking a break once or twice an hour for just a minute or two. I'd recommend about 50% standing, 50% sitting on average. And you'll be a lot more comfortable and you will prevent repetitive strain injuries.